Hello friends, and welcome back to my channel. I am Dr. Arif Akhtar, a urologist, and I am dedicated to spreading awareness about urological health. So today we are diving in a very important topic. We call it a kidney cancer. It is crucial to understand that the risk and the predisposing factors, because earlier awareness can make a significant difference in prevention in the overall surgical or the medical outcome of these subset of the patients. So let's start with some facts. So this fact is from the Indian as well as the global perspective. So kidney cancer accounts for 4% of all kidney worldwide. According to the Global Cancer Observatory 2023 updates, if I am not mistaken, then 430,000 new cases were diagnosed globally last year. So if we talk about India per se, the incidence rate is comparatively lower, with approximately 16,000 new cases reported annually as per the ICMR study, Indian Council of Medical Research 2022 data. Now some of these numbers may be less because we most of the time the reporting of these kind of cancers are not done. However, the trend shows that there is a steady increase, and possibly due to improved diagnostic capability and the lifestyle changes which has happened over the last 2 decades. Globally, kidney cancer is the 14th most common cancer, but in the higher income countries like or we call it the most developed countries like United States and Europe, it ranks amongst the top 10 cancer. According to the SEER database 2023, the age-adjusted incidence rate in the United States is approximately 7.3 per 1 lakh population as compared to 1.5 to 2 per lakh population in India. So these disparity highlights the overall impact of the environmental and the genetic factors which play very important roles in the pathogenesis and the cause of these kind of cancers. So kidney cancers, primarily, if you talk about the pathology, it primarily arises from the kidney cells, the cells that make up the lining of the small tubules in our kidney. So the most common type, there are multiple different types, but the most common type is renal cell carcinoma, which constitute about 85% of all the kidney cancers we see. So let's talk about what are the most important risk factors, or should I say the predisposing factors, as far as the kidney cancer is concerned. So these conditions or lifestyle changes that may increase your risk, we call it a predisposing factors. And the most important predisposing factors is, number one is smoking. Smoking is one of the most significant, we call it a modifiable risk factors for the kidney cancer. So if I talk about the data and the meta-analysis, a 2023 meta-analysis published in Lancet Oncology confirmed that the oral smokers has 1.52 times higher risk as compared to non-smokers. Heavy smokers, we call it when they smoke more than 20 cigarettes a day, faces nearly double the risk of what a normal smoker is at. So this is due to the mainly the chemicals, or we call it a carcinogenic compounds in tobacco, that directly damage the renal cells. So the other most important predisposing factor is the obesity. So obesity is responsible for about 25% of the kidney cancers cases globally. Excessive fat, or the adipose tissue in medical terms, leads to hormonal imbalance, resulting in increase in the insulin-like growth factors and some other pro-inflammatory cytokines released from the body. I will quote a study from 2023 which was published in Nature Review of Urology, found that the individual with the BMI, that is body mass index, which is above 30, had a 1.8 times greater risk of developing a cancer of kidney compared to those with the normal BMI, that is less than 25. Now, as far as the other predisposing factors concerned, the third most important is hypertension. So hypertension means high blood pressure is a major risk factor which is independent of obesity. So chronic hypertension which damage the renal blood vessels, leading to tissue hypoxia. Hypoxia means there is a decreased oxygen tension in the tissue and potential tumorigenesis, that is the synthesis of tumors. One of the systemic review in JAMA Oncology in the year 2022 estimated that the individual with uncontrolled hypertension have a 1.6 to 2%, 2 times higher risk of the kidney cancer. So apart from all these modifiable or controllable conditions, we have the fourth most important factors which contribute to the development of the kidney cancer is chronic kidney disease. So the patients with the chronic kidney disease or who are on long-term dialysis are at a very elevated risk of developing a kidney cancer. So if I quote the American Journal of the Kidney Disease 2023, which shows that the overall incidence of the kidney cancers in a patient who are on dialysis is nearly 5 times higher as compared to the general population. Now the fifth most important predisposing factor is the family history and genetics, which is non-modifiable. A family history of kidney cancers can double your risk, almost double the risk of as compared to the general population. The specific inherited syndromes, we have many of syndromes like VHL disease, hereditary papillary RCCs are closely related. Advances in genomic studies such as those reported in the New England Journal of Medicine in 2023 have identified specific mutation genes such as VHL gene or MET genes, which carries a significant risk for the kidney cancer. So lifestyle choices and environmental exposures also matter. For instance, for a person who is very much for a long duration exposed to industrial solvents like trichloroethylene increases the risk. So there was a very beautiful study which was published in Environmental Health Perspective 2023. They have found that there is a 1.8-fold increase in the risk amongst workers in industry using this solvent. Now coming on to some other factors, which is adaptive factors like dietary factors. Diet which are very high in processed meat or protein and low in fresh produce can lead to elevated risk. Now this is attributed to increased oxidative stress as well as the carcinogen formations. So these are basically the most important risk factors, and whether it's a modifiable or non-modifiable or predisposing factor for kidney cancers. Now coming on to the second aspect of this video. Now let's talk about the risks associated with the kidney cancer itself. Now what are the risks if somebody is still having kidney cancers and he is not completely unaware of the fact? If undetected, the kidney cancer can metastasize, that is, can spread to other parts of the body, including the lungs, bones and the brain. So advanced or metastatic kidney cancers significantly lower the overall survival rate in these kind of patients. So if I quote some major studies, so as per the American Cancer Society 2023, the overall 5-year survival rate is 93% for the localized kidney cancer, that the kidney cancer which is still localized to the kidney, and the overall 5-year survival is 71% for regionally spread cancers. And for the cancer which has a distant metastasis, that is spread beyond the local area, the overall 5-year survival is only 14%. In India, if we talk about India, survival rates are slightly lower because of delay in the diagnosis, and we have very much limited access to advanced treatment in rural areas. So that's the reason of raising the awareness and improving early detection that can bridge the gap between the diagnosis and the treatment. So these are all sort of the things which is we talk about the kidney cancers. Now here is the good news. So if you have the power to lower your risk, let me summarize some actionable steps that you need to take. The first one is the quit smoking. If you are a smoker, then you have to quit smoking. Then resources like nicotine replacement therapy and the counseling can help. The second most important is maintain a healthy weight through a balanced diet and regular exercise, as obesity is the independent risk factors. Now monitor your blood pressures and keep it under control with medications if necessary, because apart from the obesity as well as the nicotine or the smoking, the third important factor is the blood pressure or the high blood pressure. Stay hydrated, and limited access use of painkillers, over-the-counter drugs, as these can harm your kidney over time. Now, when we call it a painkiller, so we are in the habit of popping in extra painkillers whenever we have pain for the reason which is unrelated to the kidney or some other. And of course, the regular checkup is most important. If you have a family history or the risk factor associated, speak to your doctors, especially the family doctors, about the routine screening protocol. This is very important, especially in the patients with the family history of kidney cancer. So kidney cancer is a very serious disease, but awareness and proactive measures can make all the difference. Now, these are very much the predisposing of the risk factors which are associated. In the next video, I will try to summarize what are the treatment protocols, how we deal with these kind of patients, and share this video with your loved ones to spread the knowledge, because this is very important, because most of the time the kidney cancers do not cause symptoms, and whenever they cause symptoms, these are advanced stage of the disease. So if you have any questions or topic you would like to cover, leave me them in the comment box. Together we can work towards healthier lives. And thank you for watching, and don't forget to like and hit the notification button. Take care and stay healthy. Thank you.